So let's get going. We are going to begin with a session called Teaching Public Health, the Past and the Present. And instead of introducing Alfredo Morabia, I would like to introduce his video, as he has requested.
What I am today is the editor-in-chief of the American Journal of Public Health. This is the journal. I mean, you receive it, you read it online or receive it in the mail, but you may not realize what's behind that journal. This journal that you get is just the tip of the iceberg, but I don't like this expression because icebergs, as we know, are disappearing. The journal is not. and icebergs are cold, and this is a very warm and vibrant community behind that. And I just want to remind you that behind this journal, there's not only the set of editors, 25 editors, experts in their field with all their connection in universities and campuses across the country and the world, but there's also all the production team. This is an independent journal. This is something that APHA has been carrying for more than 100 years, you know, independent from any corporate or commercial interest. We are producing this journal entirely with our team. And so we have a production team, people that deal with articles, copy edit the articles. We actually compose the journal, the cover, and we disseminate its content on media. And the journal is nested within the APHA. So I have monthly personal contact and discussion with the executive director, Dr. Georges Benjamin. There is the executive board and public health people who think and help and advise us. And then there is the communication group and the policy group and the lobbying group. And all these people have their network. And all together around this journal, there are hundreds of thousands of neurons. You know, it's like a cortex that go deep into public health in this country. This is what the journal is, and I just wanted to mention before we start, since this is the session organized by the journal.
It's the first time I've seen an infomercial at an academic. That was wonderful. One more word about Alfredo Morabia. He's a professor of clinical epidemiology in the Department of Epidemiology at the Columbia University Mailman School of Public Health and a professor of epidemiology at the Barry Commoner Center for Health and the Environment at Queens College, City University of New York. So, Alfredo, let me welcome you up, and you can bring up your panel.
Thank you. Thank you very much, Carrie. Thank you, Sandro. I mean, I totally share Carrie's opinion on you, as you know. And I have a disclosure about the video. Someone asked me if there would be an English version of it. I'm sorry, that's the English version. Okay, so let's start with our session, Teaching Public Health, Past and Present. And let me call the participants to the session: Dr. Benjamin, Professor Dean Petersen, Dean Wykoff. And I will start by introduce each of the participants, the panelists, and then they will have a short presentation, 7 minutes, and we'll open the floor for a discussion with you all. So let me start with Dr. Benjamin. So Dr. Benjamin has been trained in Illinois. He's a graduate from the Illinois Institute of Technology and the University of Illinois College of Medicine. He's an MD. He's board certified in internal medicine. He's a member of the National Academy of Medicine. He's a former Secretary of Health of the state of Maryland. And he currently served as the Executive Director of the American Public Health Association. And as such, as you know, he's the publisher of AJPH. And I've known Dr. Benjamin for 3 years now. We meet once a month, and I love those meetings because it takes me behind the scene of what's going on the Hill. And And lately, as you know, for the last year, he's been up on all fronts. You know, you can see him giving one punch, two punch, you know, on the news with sentences that kill or that praise about different issues that this administration is doing, about guns, about insurance, about the environment, and that's not, you know, fortuitous that he's been named as among the 100 most influential people in healthcare, and he's ranked 66. So if you want to have a relative idea, Francis Collins, the director of the National Institute of Health, is 70th. So 4 ranks down. And so George is, the administration is giving a hard time to public health and therefore a hard time to you. You know, 1 year is down, 7 more to go. How do you feel about that? There's no microphones? Yeah, just.
Yeah, well, you know, like 2.5 years left to go. So we'll see.
Okay. So our second panelist is Donna Petersen, and Donna has been trained at Hopkins in the 80s. We were there together, actually. She has a master in public health and a doctorate degree in maternal and child health. She's now a professor of global health at the University of South Florida. And she's also dean of the College of Public Health and senior associate vice president of USF Health, all at the University of South Florida. She has a very impressive 45-page CV. But for the purpose of this meeting, she's the chair of the board of the Association of Schools and Programs in Public Health. And from 2011 and 15, as we heard before, Donna has chaired the task force framing the future, the second 100 years of education in public health. Do you remember the commentary you published in AJPH about that? Okay, great. So there was Randy in the task force. There was also Dick Riegelman, and probably other people in the room. So Donna, you live in Tampa. So how was it last September with Irma?
Irma Gerd!
Okay.
That was the rally cry.
All right, and so the third panelist is Randy Wykoff. He's a physician. He's a board certified in pediatrics and preventive medicine. He has also training in tropical medicine, and he's done all that at Tulane University. You play mandolin. Do you know the Mandolin Brothers in Staten Island? That it's the best musical store in the world. It closed, unfortunately, but I just wanted to know if you knew that. So Randy started his career in public health in South Carolina, Upper Savannah. That was really the heart of South Carolina, right? And he then was with the FDA. He then was Deputy Assistant Secretary of Health. And from 2002 to 2006, you were Senior Vice President of the International Operations of Project Hope. And what I like about this project is that its aim was empowering healthcare workers. And I found that in this program, this notion of empowering, public health professional and students, it was not very present, so I'll be curious to have your opinion about that. You're also a member of the board of the Association of Schools and Programs of Public Health. But since 2006, most importantly, you're the founding dean of the College of Public Health at East Tennessee State University, ETSU. And ETSU is in Johnson City. You're just at the edge of the Cherokee National Forest. Must be beautiful. You often hike in...
But we're not hiring right now.
Okay. All right, I'll come for a hike in the Great Smoky Mountains once. Okay, so those are our panelists, and so let's start with their presentation. Georges?
You want me to come up there, or I can do it from here?
I think you come here.
Right there.
Yeah.
Thank you. Well, good morning, everyone. Well, I'm going to talk a bit about creating the pipeline. So I'm just going to start by saying there are lots of measures out there, but if you just think from the governmental public health perspective, the number is about 500,000 public health workers, and that number has frankly been consistent on average for many, many years. If we think about the non-traditional workforce, which is kind of everybody else, and as you saw, the growing part of our workforce, nobody has any really good number as to what that is. I like to think of as the fact that since we're going to one day take over the world, that it's 300 million, but we'll see what that actually looks like. The basic work has not changed. I still think that the 10 essential services in context is basically the work that we still have to do. I mean, there's still very topical issues like public health preparedness has gotten much better, risk communication as a skill is much more important, but the basic work that we have to do hasn't changed. I do think the practice and research environment has dramatically changed. The fact that the social determinants are a much bigger focus of our work. By the way, it's always been a major focus of our work, but people are now recognizing it for what it is as a discrete entity, although the politics around that, as you know, are really challenging. The globalization of these health risks, the fact that you're one plane ride away, one train ride away, one bus line away from some terrible infectious disease, the fact that even the globalization of obesity, so even chronic disease has the globalization front, the fact that a single hamburger patty is produced from meat from a variety of places. The social media impact on information and knowledge has really worked with the internet to democratize information. We used to own it, and if we didn't tell you what it was, nobody knew it was a big secret. But now they don't really need us to get the information. Unfortunately, they often get the information that is wrong, and we have a real challenge to correct it. We have an aging population, and of course, an increasingly diverse population. So all of those factors tell us that the environment in which we're working with has dramatically changed. Of course, the students have changed. The millennials, who are certainly have always thought they were taking over the world, and this weekend we discovered that they are. They're entitled, they're very tech dependent. And that means that they actually, not just they use technology, but they actually are dependent on it to talk to one another, to engage in their everyday lives, to apply for jobs, to do things that I order food. I mean, do things that I never, ever conceived of doing on a piece of technology. They certainly want instant gratification. They have big expectations. And again, as I saw, I was down in D.C. for the big march for our lives this weekend. I can tell you these young men and women are absolutely fearless. NRA, watch out. And we have a big need for a pipeline. No matter how you look at it, we've been talking about 40% of the workforce retiring for the last 10 years. Lots of things have in many ways delayed that. Also, the number 40% is kind of a rounded figure for the number of jobs we've lost in public health over the last several years. That's in governmental public health, so we're not quite sure what all that means. But we do know that even though less jobs in government are an issue, we believe that there's enormous growth in the private sector. And obviously with the aging workforce, at some point, the joints ultimately really do give out. We all have to retire, and that workforce is going to have to be replaced. With that, I'll stop and turn it back over to the next speaker.
Thank you very much. Donna, your turn.
All right, thank you. Good morning, everyone. It's an honor to be here with so many good friends. So talking about teaching public health, I was asked to talk about what we're doing today. And I have to put in a shameless plug for Framing the Future, but people did it for me, so thank you. All of this material is available on the ASPPH website, and as I like to say, this was an incredible effort, incredible group of people on the task force, but it was really a national conversation that we had all over the country. People invited me lots of places, and we engaged lots of folks to talk about this. And all of this work represents the best thinking of people around the country at a point in time. That's all it is. But it does suggest things that we might consider as we go forward. And what Framing the Future, I think, led to, as has already been said, is changes in accreditation to reflect the reality of what's going on in the world. So in 1915, I know you've all read the Welsh Rose Report. You read it annually, you know, just to refresh yourself. It was about training physicians to get MPH degrees to lead the emerging health departments that were being formed. And today we teach high school students dually enrolled in community colleges all the way through our PhD, SCD, DRPH programs, and everything in between. Our students come from everywhere. They aren't of one type, and they go everywhere, as has been said. And so where are we today? Well, we are in the midst of an incredible transformation informed by the reality of the world we live in and what we are anticipating for the future, and policed by, if you will, our new accreditation criteria. And I think where most of us are focused is rethinking our core curricula, but also rethinking the concentrations that we offer to our students. So back in the day, most of us who earned public health degrees, we had those 5 core classes. They were sad to say, they weren't all of excellent quality. Not entirely sure when you took them or why. I know a lot of students would wait till the last semester to take whatever they feared the most. That's not foundational to your learning. And as we know, these were not necessarily connected to each other nor to practice. And the new criteria dispenses with that model entirely and says, please show us how you are conveying foundational knowledge, how you are building foundational competencies, and how you are giving students the opportunity to apply and test their competency in actual practice. And again, here's what that looks like, informed again by lots of different organizations and institutions that were having the same conversations that we were having, and in fact were part of the larger conversation. And you can see what looks now in the competencies are much more practice-based skills, because that's what the environment demanded. That's what the professional workforce told us that they wanted to see. And again, so as we're rethinking core curricula and transforming what that might look like and how we might achieve that, we're also rethinking our concentration. So again, back in the day, we had to offer an MPH degree in each of those 5 core areas. The new criteria dispenses with that entirely and says, offer whatever makes sense to you based on the strengths of the members of your institution, the faculty, what the community that you serve tells you that they need, and what students are demanding. And that new generation of students is demanding. They want things the way they want them. And I went on our application website and just pulled out things that, as Georgia said, would have sort of been unthinkable in my day. You would have never gotten an MPH in food safety or in justice, right? But these are all available now among a lot of others. The list of concentrations is huge, and it grows each day. How are we teaching? A few of us are still in classrooms, but a lot of us, our students are learning out in the community. They're learning in the halls where decisions are made. If they are in a classroom, it's not sitting in long rows, but it's on chairs that move around. We actually have movable wheeled chairs, and it's just terrific to watch students just spin around the room. And of course, students are learning on their own wherever they choose. And why are we teaching what we do? So these are the pictures of today to bring us ahead. I love the Irma. That's me in Tampa. And that's literally what the storm front looked like if you were there. And we know all the things that are happening in our society: opioids, incarceration, women's marches for our lives, Black Lives Matter, and of course everything going on in the administration demands that we think about how we teach and prepare our students for that reality, but also the future reality. So what are we doing today? I don't know that it is much different than what we were doing in the past, but we certainly have to commit to continuing to help facilitate learning, to make sure our students understand what public health is, make sure they understand how to learn. We know that the content changes almost every day, so they have to understand that learning is a lifelong proposition and that they have to learn how to do that. We absolutely need to prepare professionals for practice. We have to engage in meaningful work in the community that informs that teaching. And clearly, technology isn't going away, and the ways we utilize that in or outside of the classroom continue to evolve, and we have to embrace that as we, Steve says, we are now empowering the future. And I will stop there with my favorite cartoon. Turn it over to Randy.
Thank you very much, Donna. Randy Wykoff.
Well, thank you very much. It's a pleasure to be with you all today. I'm going to talk a little bit about nothing. I'm pressing the wrong button. There we go. I've been asked to talk a little bit about a conceptual orientation to public health teaching, which, with your permission, without it, it's not going to matter. I'm going to change it to a conceptual orientation to public health education, because obviously education in public health is a great deal broader than just teaching. These are my own comments. I'm not reflecting the Education Committee of ASPPH, which I chair now after Donna gave it to me in such good shape. I'm not even reflecting the comments or the perspectives of my co-author on the book chapter. I'm really trying to tell you what I, as a dean for 12 years, see as our mission in educating students, having come to this from the practice side, having been in practice for many years. So I think there are 5 things that we have to make sure we deliver to our students. The first, of course, is we have to explicitly address the needs of the current job market. Secondly, we have to provide technical, applied, and cross-cutting skills necessary for an entire career. Third, we need to deliver the benefits of accreditation and certification. Fourth, we need to be consistent with the mission of our host institutions. And lastly, we need to be aligned to the challenges of the future. Now, some of these make perfect sense to you all. Some of them may be less obvious, so I'm just going to go through each of them very quickly. The first, explicitly addressing the needs of the current job market. Except for undergraduate, we're all pretty much in agreement that we're preparing grad students for the job market. That's no secret. We can debate whether we are at the undergraduate level or not, but I think that's a debate that doesn't actually have to happen. So obviously, we need to know what jobs our graduates are getting, and very simply, we need to know the requirements of those jobs. My only caveat is twofold. One, we have a tendency in higher education to suggest that we know what the job market should want, as opposed to letting the job market really drive what we do. So we have to be careful that this requirements of the job come from the job market and neither from academia nor from our accreditation requirements, okay? And that's not only content, but also deliverable. As we go forward in the next few decades, we're going to see increasingly that what we offer as higher ed, which is courses, certificates, and degrees, is not necessarily what the workforce wants. And we have to be sensitive to that evolving change. The second, provide technical, applied, and cross-cutting skills. Obviously, our students are going to have many more jobs than the first one that we prepare them for. And so in public health, we have to give our students a set of understanding, command, or mastery, depending on the level, undergrad, master's, doctorate, of a range of technical skills. We also have to give them the ability to apply those skills, but we also have to give them the cross-cutting skills that are necessary for success in the workforce, like teamwork, problem-solving, creative thinking, innovation, and so on. And I think in public health, we're really, really good at doing the first one. We've been teaching the technical aspects of our profession for a long time. We're getting better at teaching the second. If you look at the agenda today, and if you go to a lot of meetings, people are talking much more about experiential learning, case studies, hands-on, and so on. I think we're not very good at teaching the last, and that's not just public health, that's higher ed in general. Employers constantly tell us they want teamwork, problem solving, creative thinking, communication skills, professionalism. In higher ed, we say, oh, we teach those things. And I say, show me where we do it. And we're really not very good at doing that. And I think we need to be much more explicit in that in the coming years in order to meet the needs of the workforce. The third area is obvious in one way, and that is the benefits of accreditation. All of us understand the value of our institutions being accredited. But I think in the coming years, we're going to increasingly need to focus on individual certifications, badges, and training for individuals. Because especially at the undergrad level, if we're putting undergrads into the workforce, they've got to be able to distinguish themselves from others. And it's going to increasingly become certification. The employer needs to know what that student can do as opposed to what that student's degree is. The fourth one here is the one that perhaps you all think about less than I do, and that is that our public health education has to be consistent with the mission of its host institution. And I think about that because my institution, East Tennessee State University, was created over 100 years ago explicitly to improve the lives of the people of Central Appalachia. That's what it was created for. It was initially a teacher's school. By the 1930s, we had a minor in health. By the 1950s, we had a degree in public health. And even the work we do today, opioids, tobacco, obesity, women's health, are all focused on our region. And it's illogical to me to think that that university should be the same as Boston University or Johns Hopkins or any other. Every university needs to have a unique mission. If all we are is a small Johns Hopkins, we will always lose, because Hopkins can be Hopkins better than we can. But we can be East Tennessee State better than Hopkins can. And if you don't believe me, come down and visit. And lastly, obviously, we need to be aligned to the challenges of the future. In some way, that's obvious. The future of the workforce is changing. But also, as has been mentioned earlier, there are advances in pedagogy. Higher ed has been really good at studying how people learn. We've been really bad at incorporating that into the learning process. And we need to be much more explicit in that. So obviously, we need to have what's now called a QI relationship. We need to be constantly asking ourselves, what can we do better? We need to keep an eye on the market, and that's the job market, that's the education market, and frankly, it's politics as well, because higher ed is under attack today because we are not delivering what's seen as necessary for the workforce. And lastly, we need to be willing and able to evolve rapidly. And if there's one thing that higher ed is not known for, it's its ability to and willingness to evolve rapidly. So I've put up 5 things that I think are relevant to an orientation to public health education. That's for East Tennessee State University. Is that right for all of you? No, of course not. Because an orientation to public health education is not a product. It's not a list. It's a process, right? It's a process of each of us asking ourselves, what do our students need to be successful, and how do we get them to that? If we do that, then we've got the right orientation. This is just my ideas. And again, regretfully for y'all, we're not hiring. I'll turn it back over.
Sorry, we have 5 minutes for questions?
Yeah, for questions, discussions.
Okay, so I think we just have time for short questions. I will start with George's. I mean, education has been highly dependent on federal funding, over the last 50 years, et cetera. There is this infamous 80s in which under Reagan, the funding were slashed by half from 400 million to 200 million. How does funding look like under this administration?
Well, funding actually, interestingly enough, has been pretty much stabilized. Mostly because the Congress has recognized the need to continue to invest in innovation and research, despite the administration's efforts to slash it. So I think that the research and innovation dollars are going to continue. I am very concerned about basic funding for education throughout the whole educational system. Rising costs, rising tuition costs, et cetera. That's a challenge I think that we still remains and something that we're going to have to figure out how to address.
Okay, thank you. And Donna, here's a question for you. How will we know a few years from now that we have actually empowered the future? How will we evaluate, the recommendation of the task force?
So that's an excellent question. I get asked it all the time because change is hard, sorry. As much as we want it to be exciting, people don't like to change, and so they like to say, well, how will we know? And to me, that's not the right question. It's how will we know that what we've been doing makes a difference? And I think we have some we're creating a learning community where we're learning from each other and we're looking at best practices that are emerging. We now have certification, so we can look at the performance of students on those tests. And as Randy says, we have to constantly be going back to our employers. And at least in my space, in my community, they're telling me that they think they're better prepared than they used to be. They come more ready to work. They come with a more professional attitude, some of the soft, we call them soft skills, we shouldn't because they're very hard. But I think, we have to monitor ourselves, we have to be accountable to ourselves, but I think to not change is not acceptable either. That's a choice we've made as well. So we need to evaluate everything we're doing and making sure that we're meeting what the community wants, what employers want, and what our students seek as they learn and grow.
Thank you. Thank you, Donna. And Randy, you have this experience with empowering healthcare workers. How do you bring this concept in this, the topic we are discussing today? How empowering students, empowering, the health professional will be training?
Well, I think empowering students starts with allowing them to be passionate about the field of public health. That's what we all have in common, is the realization that against all the backdrop of all the problems we have as a society, we've got this generation of kids coming up that are altruistic, they're committed, and we need to just let them know that public health is one of the vehicles for doing that. And then we as the institutions have to be willing to change pretty rapidly because their job market changes, their passions change. We have to be able to make sure that we're preparing them for the jobs and for the world they're going to be living in.
Thank you. Are there questions? We have time maybe for 1 or 2 questions. Yes. Yes, here.
This is a very minor one to Donna. I would like to know why mental health, that looks like a very important topic, is not listed in the foundational principle.
I'm racking my brain. It's got to be in there somewhere. Is it nowhere?
I couldn't find it. Maybe my glasses.
Yeah, I think it's an excellent question. I don't think enough of us do mental health. We don't, some of us do. It's not, it hasn't been considered core to what we do, but I think it must be if we care about human health. We have to care about it. I think a number of us are doing more in that area, but I think that's, I'd have to go back and see where it is. You want to say something?
Yeah, I think the answer is that we're the only nation in the world that divides medical care from public health, and it sits on the medical care side of the house in many places. Many of the health departments in the country don't have mental health as part of their department. They certainly do a lot of mental health, and then even sometimes substance abuse is the bridge between the two disciplines. But when I was the health secretary, I had both substance abuse and mental health as part of my empire, and we absolutely. But a lot of states it is separate.
But
okay.
the criteria evolve, so I'll certainly take that back.
All right, that's it for this introductory session. Please join me in thanking our panelists for this great introduction.